Great. Hi, everyone. Good morning. Thank you so much for joining us in the first ever Women's Wellness Series event here at Lowell General Hospital. Just so you know, we are recording this webinar today so that we can get it out to anyone who is unable to make it. The philanthropy team is excited to introduce a series of women's wellness focusing on the importance and the key issues women face within their health. The events in 2022 are being sponsored by Enterprise Wealth Management. We thank them for their support of women's wellness. Today's webinar will be recorded and put onto the Lowell General Hospital Women's Wellness website. If you have any questions throughout the program, please put them in the Q&A box below. Thank you for being here. I'm going to turn it over now to Jennifer Hansen, Director of Philanthropy. Jen?
Hi, everyone. Thanks so much for joining us today on the inaugural session of the Women's Wellness Series. The genesis for pulling this together came over the last year or so as we were impressed by how many folks would reach out to us with questions on healthcare and how to access various areas of healthcare, in particular, finding primary care physicians. So we thought this would be a relevant and poignant topic to kick off the series. Once again, a special thanks to the folks at Enterprise Wealth Management for sponsoring this and supporting us. We're looking forward to connecting with all of you in some way. Our hopes when we launched this was that we would be doing this in person. Obviously, the state of the world and the state of COVID affairs does not allow for that, but we certainly hope that subsequent sessions will allow us to meet in person and connect on a more personal level. With that, we're happy to kick things off today, and we're thrilled to have two outstanding practitioners with us participate. I'm going to turn things over to Dr. Pauline Tsirigotis of Mill City Medical and Karen Poushter of Merrimack Family Medicine. Thank you both.
Thank you, Jen, and thank you for inviting us and having us. My name is Pauline Tsirigotis. I am an internal medicine clinician. And what internal medicine means is kind of a traditional training, more hospital-based. And at the time when I trained, I thought I was going to be a cardiologist or a gastroenterologist. And probably my last year of training decided to go into primary care. I am originally from Lowell and never thought I would come back to Lowell to practice. And I came to Lowell and worked in the emergency room actually 20 years ago. And that's when Dr. Pickle found me and recruited me to come and stay in Lowell. And again, I never thought I would stay in Lowell for a long time. And here I am 20 years later. I am with Mill City Medical Group. Mill City Medical Group is a large internal medicine practice, and we have 2 locations in Lowell and have been very successful and very happy to be here. So thank you very much for including me today, Jen.
And I am Karen Poushter. I am a family nurse practitioner, and I've been doing this for close to 35 years, I can't believe. Before I was a nurse practitioner, I was a nutritionist. I was a registered dietitian, and I really loved doing that. But I felt that if I really wanted to reach people, I could do that much more effectively as a nurse practitioner, as a clinician, than as a nutritionist. So I went back to school and became a nurse practitioner. And I work at Merrimack Family Medicine, and we are a family practice. So we basically see anywhere from newborns to very senior citizens. Our practice also has doctors who do obstetrics. They deliver babies. So we truly are womb to tomb. And we have a very nice, we have I think 10 healthcare providers, 10 clinicians in our practice, a very nice, diverse group of people. And I've been here for 19 years.
Great. Thank you so much for introducing yourself. Just to start the conversation off a little bit, could you tell me what a primary care provider is, a PCP, and why it's important for women to have one currently?
Well, I always think of a PCP as like it's your point person. It's the person you go to first for just about any medical problem, question, concern that you have. And I think the idea of a PCP kind of grew out of some of the insurance companies when you started to need referrals to see specialists. So they wanted you to have a person to arrange that. So a PCP really kind of coordinates your care. And like I said, it's the person that you either call or visit or send a message on the patient portal first for any concern. And then from that point, if you end up seeing specialists or anyone else in the team, we're still kind of in charge or not controlling, but we're a team with this, but we kind of make sure all the pieces are in place. We make sure your care isn't fragmented, that you're just seeing too many different people and no one's kind of overseeing you as a person. It's a person who really gets to know you. And more than just as a medical problem, I really like to get to know all my patients. I know what's going on in their lives, their families, their jobs, what they're doing at this point, what the stresses are in their lives. So we tend to see you as a whole person. We also make sure that all your screening gets taken place. So trying to prevent problems before they arise, making sure you get your pap tests and mammograms and screening for any number of problems. Dr. Tsirigotis, do you want to add to that?
No, thank you, Karen. I agree. I think of the PCP as more of like the quarterback of the team, right? And so the quarterback has an essential role. It's always not the biggest role, right? In a team, depending on your longevity. So I would say years ago, there was this concept of the general practitioner. If you remember Little House on the Prairie, Doc, who would go to everyone's house and see everyone, that was the GP, right? That was years ago, the idea of general practitioner. And back then there were only like 200 medical conditions that we had to know about. And with the advent of technology and time, there's thousands and thousands of medical conditions. And through those times, the roles in medicine have changed, where you have far more specialists. And so then the advent of the primary care, the internist, the family practitioner, we don't use the term GP anymore because that really was a shorter time frame of training. So in the olden days, a GP trained 2 years and went out and practiced. And you still see some of that in kind of rural America. And nowadays it's a different kind of training. And so now the general practitioner thought philosophy is gone. And now it's the primary care, the internist, or the family practitioner. And what they really do is help kind of coordinate your care. They're the cornerstone of the healthcare. That they are that one consistent person in your life. Now, if you have a cardiac disease, if you've got cancer, if you've got a renal condition, those other specialists might be someone you see all the time, but they might not be somebody who is with you with longevity. And so the role of the PCP, to the best of our ability to do, is really the person who, as Karen said, coordinates your care, kind of knows you, tracks you, follows what you do, helps keep all of the coordination. So if you're having a hard time managing and following up with specialists, we're the ones who can help coordinate. We're also the one who's probably going to see you first for a condition. And if we know what to do with it, we will manage it. But clearly we don't know everything. So as things progress and they become outside of our comfort level or expertise, especially as we said, is conditions change and newer things come up, take COVID-19. Nobody could have foreseen that or been trained on that. Then we rely on the specialists who need us. And our role is to kind of, again, make sure that the care you're getting there is sufficient for what you need, and that when you can come back, we can then move on and see where else you need to progress. So I think the role of the PCP, especially in newer times where you're seeing urgent cares opening up and a lot of transactional events going on, is to always reach out to your PCP first. Can they help accommodate you? Can we see you first? Is there somewhere where we can help guide you onto what kind of care you want? Before reaching out or going to an urgent care or getting to the emergency room. Now, mind you, if you're having chest pain and you can't breathe, please go to the emergency room and don't call us first. But I always think of us as the PCP as kind of like that quarterback of your team.
Thanks, Pauline. That's great, actually. And, you've given us a lot of information. I'm wondering, since you've talked about, both of you have spoken about the importance of having primary care, the different types available. I think some people ask the question, what's the difference between a nurse practitioner and a primary care or family medicine or internal medicine? Could you two walk us through that? those distinctions a bit?
Sure. Well, of course, there's the obvious seeing a doctor, which people have been doing for a long time. And now there are also what we call advanced practice providers, and those are nurse practitioners and physician assistants. Nurse practitioners initially train as nurses. We're all registered nurses, have at least a bachelor's degree in nursing, and then an advanced degree, whether it's a master's or a doctorate, to become a nurse practitioner. And then a physician assistant, essentially we all kind of do the same thing, but the training for a PA, they have a bachelor's degree and go on for a master's degree to become a physician assistant. So they just go through a slightly different process. One has more nursing, one has maybe more of a medicine base, but all kind of practice in the same way. Nurse practitioners do specialize in their training. So you've heard of pediatric nurse practitioners. There are women's health, there's family practice, there's adult gerontology, psychiatric, midwives are nurse practitioners, and even nurse anesthetists. So PAs don't specialize in their training, but they often specialize afterwards. And I'll also mention that a lot of NPs and PAs actually work in specialty practices, just like doctors do. So those are usually the kind of people you'll see. In some practices, you can pick any of those as your primary care provider. In our practice, you pick one of the doctors, but then you can see any of the advanced practice practitioners for any visit, or even to see them pretty much exclusively if you prefer.
Karen, can I interject also is, very often you'll hear the terminology extender, right? And so what you see is like the general practitioner, things have evolved. So originally where the NPPAs had come in was this extension of the clinician, right? So it was always kind of their like sidekick. And through the advent of healthcare and primary care, as we've evolved, the NP and the PA are advanced practitioners where they're pretty much doing the same thing. And so they're more colleague now than, the kind of derogatory term of extender. So often a lot of people will say, is this person is equally qualified? And we would say, yes, we work as continuous colleagues within one kind of organization.
Absolutely. And even within our practice, we're always talking to each other, consulting, asking questions, whether it's of another nurse practitioner, PA, or one of the doctors will come in and ask us questions. Everyone has their areas where they have more expertise, and we're all a team. We all want to share that information with each other. There's also, Jen, you mentioned who you might see. I'll just throw in here that because this is on women's health, is the gynecologist. And when I was young, in my 20s into my early 30s, that's the only person I saw was a gynecologist. I think that's really changed more. And I think most gynecologists would still like you to still have a primary care provider, because they obviously don't deal with the whole body. And also, that being said, your primary care provider can provide a lot of gynecology. I do mammogram. I'm sorry, I don't do mammograms. I order mammograms. I do Pap tests. I do a lot of women's health, a lot of gynecology. Obviously, many problems you have can be gynecological, and many of those we can deal with. And if it's beyond our scope of practice, then we can always refer you to a gynecologist. And even for having babies, you can see an OB, but if you're in my practice, you may choose to stay in the practice and use one of our doctors who does deliveries.
Yeah, and I think also the idea of the gynecologist also came up years ago. So again, I've been doing this for 20 plus years. And when I first started training, it was mostly a male dominant role in primary care, internal medicine. And given that, a lot of women had a gynecologist because they just felt more comfortable. They were going to deliver babies at some point. And so that's where the role of the gynecologist came up. Through the years, the gynecologist has also become much more subspecialized, right? So they're dealing more with gynecological specialties. They're doing surgeries as well as deliveries. So they're still considered a world of primary care, but I think right now they wouldn't consider themselves primary care. They would consider themselves a specialist.
Thanks so much. So this is great information. And before we move to take questions from our audience that they can put in the Q&A session, we've talked a lot about the importance of primary care and the distinctions between, but you know, as we move further in the conversation, you know, how to access one. So here at Lowell General Hospital in Circle Health, we have some great options, and you can look at our website certainly for some background. But you know, in the interest of making it, I think Pauline and Karen have touched on what an important and personal decision and relationship this can be. Feel free to reach out. We'll put my email and Kylie's email in the Q&A session for everyone to read, to have, you know, email us directly, and we can help you land on someone terrific. Pauline and Karen can talk about their own practices, but certainly if you have certain criteria or things that are important to you in making a selection, Kylie or I or one of our colleagues here at the hospital would be happy to work with any of you to try and find that most perfect fit. But with that, Karen and Pauline, do you have any thoughts or information you'd like to share about, you know, for those who are looking for new primary care, and you know, best practices or words of wisdom you'd have?
Sure. People ask me this all the time, friends, family, how do I find a PCP? I think the most important thing is recommendations from people you know. Ask your family, ask your friends. Someone found me on, I don't know, Tewksbury Moms or something, some of the social media sites. But word of mouth is really a great way. Of course, you want to make sure whoever you pick as your PCP is in network for your insurance. So that's a pretty important thing. A lot of physical exams are not, you don't have to pay for that, but for anything else, it's pretty much more cost effective to get someone in network. I also think it's important to have someone who's not too far away. I know I have patients who have moved away and they still drive in snowstorms for hours to come see me. But I think it's a lot easier if you can get in to be seen. We do have televisits as an option, but it is nice to be close by. Also, if you already are seeing a number of specialists and they are also in one health system, for example, if you see people in the Circle Health system, then it would be ideal to see a primary care provider within that system. Likewise, if it's in another system and you really want to stay with them, it might just be easier if they're all within that same hospital group. Pauline?
Yes, I agree with all of that, Karen. The other thing I think it's really important is a little bit of self-reflection to find out what is it you need and what are you looking for. I know for women, healthcare is really important. We are the cornerstone of the health. We really manage our husbands, our children's, our family's healthcare. And so often what you will find is that a woman will find a PCP and just drags her kids and her husband to the same place. And it really is about, you know, sometimes a one stop fits all. And then there are other people who are very different. My husband is extremely healthy, but he's obsessed with being healthy. So he tracks his heart rate and his blood pressure and his exercise. And he wants somebody who's really involved in that and somebody who is more up to date with all the newest technology and the frills, who can help keep him on that pathway. So you have to think to yourself in terms of like, what is it that I am looking for? And was it that I need? And who is going to connect with me? And as I said before, is healthcare is just changing, right? The olden day doc coming to the house isn't there. And so there's some wonderful new advances that are coming that help us take care of you. But there's also a profound shortage of primary care. So most physicians, most clinicians, providers have very large panels. And so what we've developed are these ideas of teams, right? So again, the football team, it takes a team to take care of you. And my teams could be my advanced nurse practitioners, my nurse, my medical assistant, my secretary, the physical therapist that helps with you, the social worker. And so don't think about just the PCP you're getting in the connection, but that team that's going to embrace you and take care of you, right? So it's not just me who knows you, it's 10, 20 clinicians or 20 specialists who know you and can take care of you. And often my expertise isn't what matters, it's what the physical therapist thinks, or what my nurse thinks, who has much far better education background in terms of educating you on diabetes and how to take and how to eat and how to manage it. So what you're looking for, when you're out there looking for a PCP, you have to think to yourself, what else is my needs? Now, there's some people who like to see only the MD and that's all they want to see. And so maybe a smaller practice that's close and that maybe has only 1 or 2 clinicians fits your needs better, that works as well. If you enjoy the fact that technology and telehealth is here, a practice that engages in that with a portal and constant communication, if you feel that that would benefit you, then I would say is look for a practice that has that as well. There's also no problem with moving around. If you join a practice and you like one person and then someone else, we don't take offense. We really believe there's a lid for every pot and we're okay with it. And ultimately, we want you to feel most comfortable with your clinician, right? And so if you mesh and jive with one of my colleagues, I'm very happy for you, because ultimately it's about your care and you getting the best out of the relationship. So we don't take this personally whatsoever. And I also agree, the best thing to do is sometimes social media, ask your friends, ask colleagues, ask people who are similar to you with similar interests and maybe similar needs. There's some people who want to go to the doctor once. It's kind of like the dentist and don't want to make any contact, just do what they need to do and leave. And then there are other people who really look forward to seeing their clinician, have a list ready and really want to engage it. So once you figure out what it is your needs and what is going to fulfill it, because often what happens is patients will come to you with an expectation and an idea of what a doctor should be to them versus what we can actually provide.
Thank you. Thank you both. As a reminder, you guys can put all of your questions in the Q&A. I know that, Karen, you had brought up a little bit of telehealth. Can the two of you talk about the relationship with telehealth right now? Is that something you guys see is going to be staying in the future?
I definitely think it's going to be staying. And I'm glad we have telehealth. It really serves a very big need. Especially when COVID started and we weren't seeing anyone in the office and everyone was locked up at home. It was a great way to connect with people. I don't think it replaces being able to come into the office and seeing someone. I mean, Pauline and I have learned a lot of physical exam skills, you know, listening to hearts, checking blood pressures, listening to lungs. You can't really replace that with a televisit. But it is a great way to still connect, especially visits that are mostly talking anyway. If I'm seeing someone with depression and we're following up, it's perfect, because at this point I've already examined them and it's not so critical. There's also all that home technology, so you can check your own blood pressure and your pulse and even your oxygen level on your cell phone. So I think it's here to stay. I'm really glad we have it. We definitely embrace it in our office. But I also think that it does have its limitations, and technology can sometimes be a problem, not only for us, but for some of our patients. Some of our elderly patients have problems with it. And then sometimes if like the internet connection isn't great, it can be, you know, dropped calls and the usual, but I definitely think it's here to stay.
Yeah, I agree. I think it's here to stay, and it's also extremely exciting, right? So I think it's going to be an exciting thing to see what happens, especially engaging this younger generation into their health, right? And especially right now with more of our mental health crisis. If you can imagine, we can access clinicians all over the world and the country through telehealth once that's open. You can do it off hours, daytime, nighttime. It can meet more of your needs. And so I agree, it's not going to be the cornerstone, but if you can imagine imagine so much of what we do is automated, and I might give the same speech 10 times a day. Well, what if I did a webinar once a week or once a month with the same patients and gave that speech? So I think it's going to open up some amazing opportunities for us. And I agree there's some limitations in its managing that expectation and that limitation. So again, as Karen said, it definitely doesn't take away your annual physical and what that entails, but think of it as an augmentation, like your cell phone, right? It's augmented and it's enriched our lives, but it hasn't taken over 100%. So it should be interesting to see. And what I encourage everyone who's watching is to be open-minded to it, right? Like dip your toe into the telehealth, you know, maybe sign up for the patient portal, start communicating, just really open yourself up to some healthcare apps, because I do think they can augment and help and not take over. But I do encourage everyone to be a little bit more open-minded.
I'm also a big proponent of the patient portal. I think of all the people here, I have more of my patients who are on the portal, you know, and they have a little problem or just a question that people might wait all year to discuss it at their physical. People will send me a message or, what do you think of this article? Or I read this on the internet, or I have this problem. Should I come in? Should I see a specialist? Do I need an x-ray? A lot of those I can answer in 1 minute and take care of that issue. And sometimes I'm going to say, you know, why don't you come in and let me check you out? Or I might say, let me do a referral or order this test or just clarify. There's a lot of misinformation out there. So it's great to be able to clarify that for people.
We actually did get a question that's, how do you manage anxiety? Is that something that if somebody is having anxiety, can they reach out to you on the portal and kind of go from there to see who they need to go to, if they should come in and talk to you and kind of see what's going on?
Yeah, well, there's usually a triage process, right? So I think what everyone needs to understand is there are many layers before it sometimes hits an MD or the provider. And so that they're all, because we're seeing patients all day, right? So while I'm in the room, my goal is once I walk into that room, it's all about you. And so at that half hour, 15 minutes, 20 minutes, it's undivided attention to you. And so we might have thousands of patients. And so the ability to be able to have attention only for you and fit your needs, but also manage all of these. It's like having a lot of children and how do you manage that family? And so we need teams to do that. So usually there's screening levels and triage through that. And if you've been in a practice like Karen or mine for a long time, then you know the people who are calling you, you know the MAs that are calling you, you know the nurses. And 100%, like Karen said, is anxiety, discussing anxiety, managing it in a multifactorial way. You can easily do via telehealth or you can do via coming in. I think the nice thing about telehealth for some of these things, like Karen said, is instead of getting in the car, driving an hour or half hour, coming to see us, waiting because we got pulled away because somebody was really ill. You know, it's a scheduled time. It's a focused time on just you, and we can have a conversation on where it is to go. Now, mind you, if you're having physical symptoms associated with anxiety, where sometimes it can be your heart is racing or you feel a pressure, often we'll have to bring you in the office, right, to just examine you, just to make sure it is anxiety and not something else. So that is something you can reach out through the portal. The portal, like Karen said, is great. It is a gateway for anything you want to do. I do think us in healthcare have to learn how to manage that portal better. And I think we will with time, because right now, a lot of our older patients treat it like Facebook sometimes. And so we do want to be able to manage it better so that there are better streaming ways. And I do think with technology, the portals will get better too, where you have different options to be able to ask different questions and to get to different people.
Thank you. We did have one more question come in just before we close out. Do you have any tips for managing anxiety and managing also weight loss?
Those are two huge questions. There's a lot of ways to manage anxiety. I think there's a lot of behavioral techniques to manage anxiety that are really important that can be learned. And so I often recommend seeing a counselor or a therapist. And again, I have a long list of people who I do recommend, and not only who I recommend, but who my patients recommend. I learn a lot from my patients when they come in and they tell me they see someone who they really like. I write that name down and I share that name with other patients. So I think therapy is really important. Behavioral techniques, there are certainly medications that if anxiety gets completely out of control and is controlling you, then you may want to think about medication, not necessarily forever, but for a short time. And then obesity, where do I begin? And I mean, I was a nutritionist, again, before I was a nurse practitioner. So used to work with a weight control group. Again, managing obesity is multifactorial. It is one of the hardest problems that people deal with, and I never minimalize it to my patients. It's a hard problem. And it's multifactorial. There's many ways to approach it. And it really depends on what works for you. If you find that using one of the apps online is a great way to track your diet and your exercise, that's great. It may not work for you. Everyone is different. And just like when you're trying to stop smoking, sometimes it takes a lot of different attempts before you find one that works. There are medications, they don't work great. There are some newer ones coming out that might work better. Obviously, there's surgery if it's a big enough problem. But those are the kinds of things I talk about with my patients all the time.
Yeah, I would say is first and foremost, we need to break the stigma of being afraid to talk about it, right? So we would say that anxiety and obesity are chronic diseases, just like heart disease and blood pressure. And often what we find is that people are embarrassed to talk about it. And what I can say is that we can always help you make things better. We can't always fix things, but we can make it better. Right? There's always hope and you can always get a little better. But you also need to stick with it and ride through it with us, right? To get you to that point. And like Karen said, it's multifactorial and there's genetics that take into play. There's age, there are circumstances, there's healthcare, your medical problem, there's medication. So it's exactly multifactorial. And you can only deal with you. Right? My eye color is my eye color. I'm not going to be able to change my eye color. And so that's what I would like to say to a lot of people in terms of who they are, their genetics, their healthcare. Don't look at everyone else around you on what they're doing, but focus on you, who you are, what goals you want to get to. Don't be embarrassed to talk about it. And let's have a rational, reasonable discussion and lay everything on the table and get you to a better place. And so I think there's a lot of societal pressures on women, especially. I can tell you that I take care of men and women, and the way people talk about men and weight versus women and weight is very different. And so men tend to be a little bit more open about it, and women tend to have shame. And I think we need to break that shame and have a conversation in terms of healthcare. So what I would say is to anyone out there who's struggling with anxiety, who's struggling with weight, is don't give up. Keep reaching out, keep talking to people until you find the right person who's willing to stick with you and help you get to a point where things do get better.
I think you also need to find someone who accepts you and doesn't care in terms of you as a person. They don't judge you by your weight. I've always had patients come in and say, I saw so-and-so, and they said, you have to lose weight. And it just made them feel bad. And, we are who we are. As Pauline said, a lot of it is our genetics, our background, whatever. And I think you just need to find someone that you're comfortable with, that you can have these discussions and be open, but also find someone who's accepting of you.
Yeah, and the science is changing, right? Drastically. There are things going on in other countries for weight loss that are fascinating. So I think the olden day idea of like, you just eat too much and don't move enough is not correct, right? There's science changes to the brain and to the body. And so scientifically and medically, your body changes at certain BMIs, at certain weights, at certain healthcare. So I think you're going to see radical changes. There were actually more changes coming to America for weight loss, and then COVID hit. But if you look at other countries like Brazil and Europe, they're doing some really kind of impressive things for weight loss. So I think you're going to see more of that happen. One of the things with COVID we found is that obesity was a risk factor factor for worsening COVID. So there's a much larger emphasis on weight and weight loss. And we hope insurances cover more of that journey because it really is a chronic disease like diabetes. So I would just say is, do a lot of reading, read about the medical aspects of obesity, be open-minded, and just keep doing research. There are newer programs and weight management programs, even at Lowell General, that offer different versions and options. So you've got med management, you've got surgeries, you have different types of mechanisms and methods to kind of combat it.
Great. Thank you so much. I think we covered all of the questions in the Q&A, as well as some other ones that we had. We will send out this recording to everyone so that you can take a look at it again. If you have anyone you want to share it with, please do. Jen and I did put our emails in the chat, so please reach out to us if you want to get connected after, if you have any other questions, or if you're looking for a PCP. We're very thankful that you guys all attended today. We hope that you took a lot from the session. Please reach out if you have any questions, a topic for the future. Right now, our plan is to have our next Women's Wellness Series event in person on April 12th at the UMass Lowell Inn and Conference Center, but we will keep you posted on that pending where the world is. And the topic for our April event is going to be women's gut health with Dr. Supriya Rao. So please keep an eye out for more information and registration for that. But thank you all for attending. We hope you have a great rest of your day. Bye.
Bye.